Hey everyone, I'm Lisa Jordan, and welcome to Menopausitive,
I got a good feeling.
where we take a refreshingly positive approach to navigating menopause. If you're looking for practical tips, expert advice, and honest conversations, think of this as your personal pick and mix for how to optimize your body. Although we can't prevent menopause, we can redefine it. And that journey starts now. I've been thinking a lot about the different perimenopause and menopause symptoms. Did you know there are about 20 of them? But for some reason, symptoms like hot flashes and night sweats, they get all the PR. You know what doesn't get enough PR? Our vaginas. This beautiful, sensory, functional part of our body that basically births life will go through a number of changes when our hormones decide to jump on this roller coaster ride that is perimenopause and menopause. Some women experience irritation. Dryness is very common. Sex can become uncomfortable, even painful. I mean, what? Here's what I've learned. Night sweats and hot flashes, they eventually go away. But if you don't look after your vaginal health, that irritation will only get worse. And as women, we've been told we need to accept these changes. It's part of getting older or it's part of having children. Well, screw that. We're not here to accept old norms. You and we're here to optimize. In fact, if I were you, I would hit pause right now and share this episode with 10 friends because no one should miss Dr. Tania Adib, who is on a mission to empower and educate women that this does not need to be the norm. Dr. Adib is a consultant gynecologist specializing in the menopause. She trained as a gynecological oncologist at the Royal Marden Hospital. I mean, oh my gosh, try saying that 5 times fast. A gynecological oncologist in London, and she worked in the NHS for 30 years. Through her work with this lovely breast cancer charity, the Breast Cancer Haven, she developed an interest in non-hormonal options for women who've undergone breast cancer treatments. Her clinic combines traditional medicine with the most innovative technology for vaginal and vulval health, alongside, of course, advice on hormone, non-hormonal treatment, lifestyle, nutrition, supplements, stress management, you name it. Tania, welcome to Menopausitive.
Thank you so much. What a lovely introduction. I'm
Oh,
so delighted to be here this morning.
it's wonderful to have you. Tania, I want to start with terminology.
Yeah.
All right. I have this question. Why is it that when men have an issue, they just have a little dysfunction? They just have a little erectile dysfunction. But when women have an issue, we have atrophy,
Mm.
we have insufficient something, or non-optimized something or other. What is going on with that?
What a horrible word, atrophy. The connotation is that you're withering away. And maybe society is expecting us to wither away as we get older. But I don't think we should be calling it atrophy. It's such a rude word. And in fact, it has been replaced since 2013 with genitourinary syndrome of the menopause. And that's a lot more descriptive and a lot more inclusive because it validates the fact that women get vaginal symptoms, bladder symptoms, and sexual symptoms. So it encompasses all three of those.
And the other thing that's interesting is in society, we regularly talk about men having these active sex lives well into their 70s and 80s, but rarely are we talking about women having active sex lives into their 70s and 80s.
We're not supposed to be having sex past 50.
We're not?
We're not. Society is expecting us not to. And I get so depressed when women are told, well, it's just part of normal aging. Oh, well, what can you expect? You've had some vaginal births. Oh, well, it's just something you'll have to put up with. So what I'm really excited about is we don't have to put up with it. As we are aging, we are focusing on longevity. anti-aging for the face, for the body, for, with supplements, with red light therapy. It's all out there. And, we know how to age well, but the vagina has been left behind. And we need to really also focus on helping support vaginal health so that when we are in our 80s and our 90s, we've still got really fabulous, healthy vaginas.
I love that. Fabulous, healthy vaginas. I do think this is one topic that is discussed less than menopause. So we're going to break this down today.
Yeah.
First, can you explain some basic anatomy? All right, like what is the vagina, the vulva? Can you talk us through that?
So many people just call the whole area the vagina, but actually the vagina is the tube that's inside that you really can't see unless you put a speculum in. Okay, so only your GP or gynecologist can see the vagina. What you're looking at on the outside is all the vulva. So we've got the labia minora, which are the inner labia. We've got the labia majora, which are the outer labia. And right at the entrance to the vagina, which you can just about see, is a gland called the vestibule, which is really important.
And what does the vestibule do if it's very important?
Well, it's
Everybody lean in. Tanya's going to tell us what the vestibule is.
the vestibule is the gateway into the vagina. So keeping the vagina healthy, you have to keep the vestibule happy. And it's got nerves. That means it can get very easily irritated. If it's dry, then any kind of penetration can be really painful.
When working at its best, then, what is happening in our so if I just say vagina, as you said, like the kind of overarching term, is that okay?
Yes, yes. So, in young women who are having a regular menstrual cycle, they have high levels of estrogen and testosterone, and that keeps the tissues well hydrated, lubricated. The vagina has beautiful folds that expand when you have intercourse and that allow the passage of a baby. So that really is the only part of the body that's allowed to have wrinkles. And wrinkles are desirable in the vagina.
That's a soundbite right there. I love it. I love it. So now then as we age, so that, like you said, young women having their menstrual cycle, as estrogen starts to decline, what might women start experiencing? What should they be looking out for?
So the changes that are happening are the tissues get dry, they shrink, some of the labia can disappear, the vagina becomes shorter, narrower, and it loses those beautiful folds. Moisture and lubrication reduce. And the symptoms that can produce are things like in the day-to-day, symptoms like itching, soreness, discomfort, sometimes even bleeding when the tissues are really dry. Because the vagina is right next to the bladder, and the bladder also has estrogen receptors, women may need to go to the toilet more often. They may have a little bit of incontinence. They may need to get up in the middle of the night to go to the toilet. And of course, if everything feels dry and tight, then sex also becomes either very uncomfortable, like razor blade discomfort, or impossible completely.
Yeah, I know my experience, it was also mine didn't feel gradual. Like I had some pain during sex and it was this feeling of like it was just burning
Mm.
and you could be intimate but it just wasn't as fun as it used to be.
Yeah.
And the first couple times you're like, "Oh, I might just be a little bit dry." And then I remember sitting up in bed late one night with my phone, like Googling about this, which then brought me to see you and meet you. But this is also because we have estrogen receptors throughout that part of our body as well. You mentioned the bladder.
Yes, there are estrogen receptors in the vagina, in the vulva, in the urethra, which is the tube from the bladder to the outside, in the bladder, in the connective tissue, in the muscles. So estrogen is really important. Testosterone is actually also really important because the lower vagina and the vulva, which is the outside tissue, has lots of testosterone receptors. So both hormones are really important for hydration and lubrication of the whole area and comfort.
And there's also hyaluronic acid, right? I mean, I don't know if that's our body produces I wanna talk about it only because it's this word that we all know about when it comes to our face or our hands, like, we see it in cream, in injectables, but our body naturally makes hyaluronic acid, which
Yes.
which kind of helps, I don't know, lubricate, our eyes and our mouth and our vagina as well, is that right?
Yes, hyaluronic acid is really important for the vagina, and a lot of the topical moisturizers will contain hyaluronic acid.
And I think that's something everybody can get their head around because we know we would use that on our face,
Mm,
and we could also be using it in our vagina.
exactly. So we even inject hyaluronic acid into the vagina to help with moisture.
Oh, wow, okay,
Works really well.
we are gonna get into that even more. Everybody leaning in more. They're turning up the volume or they're now sitting down. When you were cleaning dishes or you were on a conference call, you've now turned off the conference call because you are in on this episode. Is this something that happens mostly in postmenopausal women?
So, declining estrogen levels, yes, is associated with the menopause, but in young women, hormones can also be affected by some medications that block estrogen and testosterone, like spironolactone, or taking the combined oral contraceptive pill reduces testosterone. And so that can affect dryness, both in the vulva, where there are many testosterone receptors, and also in the vagina. So we do see young women with dryness. Also, after a pregnancy, after giving birth, the vagina can feel really dry.
So it's safe to assume this is not relegated to just postmenopause. It can happen up to, 10 years before, or like you said, even in younger women.
Yes, absolutely.
And I guess as well, that's why if you're perimenopausal or even if you're young, you might confuse the symptoms with just, I don't know, like thrush or like a UTI or something. And then you might go and just get some over the counter medication for that and wonder why it's not working. And if that's not working, it could be because you're suffering from some well, geranyroderm or what's the new term? Not vaginal atrophy anymore. It's
Genitourinary syndrome.
I'm gonna let you say that word more often. But do you find young women can be confused about that because they wouldn't assume that's what's happening?
So, vaginal dryness can start 10 years before the menopause, and we've seen that in studies. So, a woman in her 40s who's still having periods can experience burning, discomfort, itching. When the vagina's dry, the normal, healthy vaginal microbiome are not in the quantities that they should be. You know, the vagina is a self cleaning organ. It has a really healthy microbiome with millions of healthy bacteria. And as the vagina dries, the glycogen reduces, they've got less food to feed on, and you're more likely to get either a vaginal infection or a urinary tract infection. So some women do really get a UTI or a vaginal infection because of dryness, because of decreasing glycogen.
Okay, and that could be treated as normal. Like if you went to the pharmacist or your doctor, it could be treated like a normal infection or thrush or whatever it may be.
So the infection needs to be treated, but you also need to be looking at the underlying cause. Was it just an infection, or is there something else going on that's causing the infection?
And when the estrogen levels fall more dramatically, what is happening down there? The walls start thinning.
The walls thin, the labia resorb so they can disappear, the vagina can narrow and shorten and lose the folds,
And we want
and
the wrinkles, remember?
we want the
We want the
wrinkles.
wrinkles.
We
We
want
want
to
plump
maintain those
wrinkles.
wrinkles. Exactly, exactly. Blood flow reduces, the connective tissue, the collagen degrades and thins, the muscles get weaker. So all these things are happening as we age.
And how common is this? Because again, other symptoms of menopause get talked about a lot more, but how common would this be for women?
It's up to 80% of women. And
80%!
yes, it is. It's just that women don't talk about it because they just find it too embarrassing. It's very intimate, it's very personal, It's difficult to talk about vaginal issues.
And, the other thing that I learned too, I mean, we're talking a lot about, your sex life and intimacy too, but it also there's other symptoms, right? I think you told me sometimes women, it's really uncomfortable to wear tight clothes.
Yes, absolutely.
Um, and we talked about the bladder already. The other thing though, I think if you're feeling this way around, you're really uncomfortable, this can have an impact on your relationships, maybe even your mental health.
So, if you're experiencing continuous discomfort in the vagina, it's going to affect how you are functioning during the day. It can affect your self esteem, your self confidence, your femininity, how you feel about yourself as a woman. And if it's then also affecting your sexual health with your partner, then that's also going to come in the way of that relationship. And I see a lot of couples having intimacy and relationship issues as women dip into the menopause. And, that can really affect relationships. I think people break up because of it.
Wow, that's really, I mean, that would
And I've
be,
seen that in my practice.
and something that can be treated or reversed even.
Absolutely. It's so easily treated, and there are so many options out there, hormonal and non hormonal.
I have to tell you, when it was happening to me, I didn't wanna speak to my husband about it, but I had to talk to him, and because when I researched it and I saw this word vaginal atrophy, I mean, even I coiled up inside. I thought, "Oh my god," even saying we have such a hard time even talking about menopause because culturally, it's been put on us that this is signs of decline and disability, and, I mean, that's not what we're about here on Menopausitive, but I didn't even wanna say the words to him. So I said to him, I'm like, "Babe, I need to talk to you about something." And I'm like, I really don't even wanna say these words to you, but I looked into it and this is what this is." Because I didn't wanna put that image in his head, of this, again, vaginal atrophy. I didn't wanna put that image in his head. I was so nervous about it. And I'm very lucky. I have a really understanding partner, and he was like, "Oh, okay, now, well, what do you do about that?" And
Mm.
is really supportive of that. And I think if any of us can have those conversations with our partners, that's even a nice way, maybe if that's a helpful line for you to start that conversation, like, "Babe, I'm really nervous about telling you this, but here's what's happening." And
And why not say, I think the vagina feels dry?
yeah,
Just say dry. You don't have to say atrophic.
yes.
It's so horrible.
I'm not
Just
gonna
say
say that word
dry
anymore.
because
I'm writing, I don't say it. I'm not gonna say it. If I say it, I have to put some money in the jar, like a swear
absolutely.
jar. Okay, fine. Um The other thing I wanted to check, because I had read, and you may have told me this, that while other symptoms of menopause eventually go away, vaginal dryness does not get better over time.
It gets worse. And any treatment that you are going to use for vaginal dryness needs to be maintained your whole life long.
And we should just sit on that for a minute because if the average age of menopause is 51, I mean, that's a lot of living we have still to do where we may be in discomfort. I don't want that. I don't
We,
want that for anybody.
with our lifespans now and estimated longevity, we are going to be spending half our lives in the menopause. So, not just the menopausal symptoms and all the effects of low hormones in terms of heart health, brain health, bone health, gut health, but also vaginal health. We need to be looking after our vaginas for half our lifetimes.
And this is how we're gonna do it. We're gonna start learning now. I read that only 10 to 20% of women suffering from vaginal dryness seek medical treatment. Is that true? I mean, it must be really embarrassing for them to go see their GP, and I don't know how often GPs are saying, "So, how's your vagina today?"
I can really believe those statistics. I think women are embarrassed to talk to a doctor about these symptoms because maybe they don't know their GP particularly well, or it's someone that they're not used to seeing. Even women who come to see me, and I'm a female, gynecologist specializing in vaginal health. Even my patients come to me and they're very comfortable talking about hot flushes. And then they say, I have another issue. It's really embarrassing, but my vagina really hurts. You know, so women find it really difficult to talk about. And so, of course, they're not going to look for help.
And this is what we're gonna do here because I think the more we talk about it, the more we normalize it, right? Then there's the more we can do about it. Um, I wanna make sure I'm tracking. So as estrogen levels decline, hyaluronic acid declines, the vaginal tissues become thinner, drier, less elastic, more fragile, which means they can be irritated easily. Correct?
Yes, correct.
Okay, so dare I say this? Is this not similar to what happens on our face?
It's exactly the same.
It's exactly the same, right? And I mean, I think on our face, we use moisturizers, we use serums, we use massage, we use lasers, we use injectables.
You can do all of those in the vagina too.
I don't want any woman missing out on pleasure and intimacy as they age and or just comfort. Can we go kind of from the non-medical into the medical? Where would we start? Moisturizers? I mean, take us through this, Tanya.
So, look, I'm going to start with women who are not really comfortable using vaginal products because not all women are. They just don't like it, they're not comfortable doing it. So, there's a lovely oral supplement called sea buckthorn oil, which is otherwise known as omega 7, which has been shown to be really fantastic for vaginal dryness. It's quite weak, but at least it's something you can take orally. Then there are topical moisturizers that go either in the vagina or on the outside, and you can use one for each. Because it's not just the vagina that gets dry, it's also the tissue on the outside, on the vulva.
Okay, hold on. I'm going to pause right there. Let's just pause because we're going to take this slowly, Tanya. We're going to take this slowly. So on the sea buckthorn, is that what you called
Yes,
it?
yes.
Is this an over-the-counter?
Over the counter, on the internet, widely available.
Okay, like, and can women take it like any supplement?
Absolutely.
All right.
Daily, by mouth.
Daily by mouth.
Yeah.
Okay. On the moisturizers and lubricants, what's the difference? What's the difference between
Okay,
a
so a
moisturizer and lubricant?
moisturizer provides hydration and it's a topical agent that you need to use consistently. So at least 3 or 4 times a week. So just like you moisturize your face daily, you moisturize the vagina and the vulva daily because you want to maintain hydration and maintain good condition of the tissues. You use a lubricant at the time of sex to make everything slippy and not make things, uncomfortable.
Okay, so the moisturizer you would use regularly throughout the week, like we use a moisturizer on our face and the lubricant to help
Uh,
make intimacy more
com-
slippy,
Comfortable. More slippy.
more
Yeah.
slippy. And listen, just like there are so many different moisturizers for your face, is there anything that women should be looking for in a vaginal moisturizer?
So there are lots of moisturizers out there, and it's often just personal preference which one you're going to choose. Um, there are those that contain hyaluronic acid, which work well. You also need to look at the osmolality, because if it's too high in osmolality, that may also not be particularly good for hydration.
What's an osmolality?
It's all about how much water gets absorbed
Got it.
into the tissues.
Okay, so we want
Yeah.
high,
Low.
low.
Yeah.
Got it. Got it. Okay, so we've talked about the sea buckthorn, moisturizer, lubricant. Where would we go from there?
So then you talk about vaginal estrogen that you place topically. So in the vagina, you can either use pessaries or a cream. They're both estrogen. Pessaries stick to the vaginal walls and then melt and hydrate the vagina. Creams are a little bit more messy, but have the advantage of also being able to be applied to the outside. So some women use a pessary for the vagina and a cream for the outside. Other women use a cream for the whole area. Doesn't really matter. Again, they need to be used regularly. It's usually a loading dose, a treatment regime of a daily application for 14 days to really treat the area and improve the quality of the tissues. And then the regular treatment is twice a week
And if you are on hormone replacement therapy, can you use the estrogen-based creams
as
as
well.
well?
Absolutely. They are super low dose, very, very safe. A whole year's worth of treatment is the equivalent to 1 milligram of estrogen tablet by mouth.
Okay, so safe
So
for
very, very safe.
when I first met you, I was interested in learning about your laser treatment and how effective it was. And I distinctly remember the look on your face when I asked you. Like, I mean, your body language, it was like the heavens had opened and the angels had started singing. It was a Harry Met Sally moment when I was like, I'll have what she's having. Because you are leading some groundbreaking, vaginal laser treatment that treats these symptoms. I mean, let's tell the world about this.
So look, I first came across the laser at the World Congress, which is organised by the Royal College of Obstetricians and Gynecologists. And this was, I'll say, back in 2015. And we have lots of the pharmaceutical industry come and place their stalls at the Congress. And there was one lone man standing next to a device, and above it was written non-hormonal treatment for vaginal dryness. And I had just started working at the Breast Cancer Haven, and I thought, I have a solution for all these poor women who have had cancer treatment. So I went and talked to him. He sent me to Milan to be trained on the device. And I've been using the laser since 2016. And I love it. I've had some really fantastic outcomes. It's a really easy, safe treatment. And it's a great solution for women who either can't or just prefer not to use hormones.
And it's made in Italy?
It was designed by a professor in Milan. Yes.
Kind of like most luxury items.
Well, absolutely. Absolutely.
So how often well, first of all, we have a video of me. Tania was kind enough to let me give this a go because she wants to share with the world how easy this is as well. So, James, can you do me a favor? Can you load that video for me? Let's take a look at me at the medical chambers in Kensington.
Yeah. All right. So I'm going to get started now, Lisa.
Oh. Oh, that's.
Yeah.
Sorry, I feel like I shouldn't laugh. You can feel the vibration.
It's vibration and energy.
It's quite pleasant, actually.
Is it painful?
No, it is not painful at all.
So I'm just working along the vaginal walls from top to bottom.
And is it better to stay relaxed than...
Much better to stay relaxed, because if you clench, then it's going to be uncomfortable.
That's where the laughter, I think, wasn't serving me.
Yeah. So we're coming towards the end now. And we're all done.
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 All finished.
Yeah.
What was that? 3 minutes? 5 minutes? Not even?
Not even.
Wow. Thank you.
You're welcome. Yeah, you get this.
You want that now?
If you're listening and you can't see this, I'm at Dr. Adib's clinic. I've got a really sexy pair of Terminator glasses on, as does she. But basically, you're inserting a
Probe.
a probe, yeah,
Yeah.
um, into my vagina, and basically, I mean, you talk through the procedure.
So the I use the Mona Lisa Touch laser, which has the most scientific studies associated with it. It's a carbon dioxide laser which fires tiny little jets of carbon dioxide into the skin at 1 millimeter intervals, and each jet goes just a fifth of a millimeter into the skin. A fifth of a millimeter. It's really, really, really superficial. And as I put the probe, I twist and then withdraw it, and it treats the whole of the vaginal wall in turn as I move the probe. And that triggers the body to regenerate. So it brings in new blood vessels, growth factors, it rebuilds the collagen, it thickens the skin, it improves moisture, rebalances the vaginal flora. So it's a natural process. It's tricking the body into thinking there's been an injury, and then this whole repair process starts. And it's really incredibly effective.
I can also say that it took less than 3 minutes. There was no you don't have to freeze the area or anything because you told me actually there's no nerve endings inside.
So there are no nerves in the vagina, so no pain fibers in the vagina, so no anesthetic required. I do, however, use local anesthetic to the outside, to the vulva, leave that for about 5 minutes, remove the cream, treat the vagina, and then treat the vulva as well.
And so, there's no pain, no discomfort. I mean, I walked in and out of there in less than 5 minutes. You can have this done on your lunch break, or just before school pickup, whatever it may be, whatever, you're doing that day. But, I mean, I have to say, in this video, I giggle a little bit because, it vibrates. It vibrates inside of you.
It feels like a vibration, doesn't it? It
Yeah.
feels like energy,
It was
but
actually
it
quite
is.
pleasant.
Yeah.
It was quite pleasant. But I couldn't laugh because if I laughed, then I clenched. And if you clench, you're not supposed to clench. So that was a bad idea. So there's part of this video where I'm not even speaking because I'm like, I really should stop talking. um, how often do you have to have, because you said vaginal moisturizers, even if we take an oral or a pessary, this is something, again, we are going to have to continue to do for the rest of our lives.
Yes,
Not just for
because
sex, again, but for comfort and
yes.
health, like vaginal health.
Exactly, because we're getting older, the tissues age. So whatever treatment you're using, it's not going to solve it because you're going to be older in a month, 2 months, a year, 2 years. So any treatment you use has to be consistent and lifelong. So with the laser, the treatment, the initial treatment is 3 sessions at 4, 5, or 6 weekly intervals. And then it's yearly single top-up treatments.
Once a year, go in and see you for 5 minutes, and that's it.
Exactly.
I mean, I cannot wait to report back on how this is. My husband's been traveling, so we haven't been able to try it out yet, but I cannot wait to share with everybody, how this is. But like I said, I have this vision of when I first met you, and you literally like kind of sat back in your chair like, "Well, let me tell you about this laser." So I'm really grateful you've let me give this a go so I can share it with everybody listening. Is there anything else on the laser treatment I've missed that you want to share, or we've covered everything on the laser treatment?
So the laser is great for dryness and for women who have a condition called lichen sclerosis, which we see on the vulva. And I see quite a lot of that. So the laser is really great for treating both of those conditions primarily.
Now, in addition to the laser, you also offer a radio frequency treatment. Tell us about that.
So radiofrequency regenerates not just the collagen, which the laser regenerates, but also elastin. So as the vagina stretches to allow a baby through during a vaginal birth, the fibers will come together but not quite heal properly. So the elastin fibers are the fibers that maintain the integrity and the strength of of the vagina. And if they don't come together quite well, then that can lead to loss of sensation during intercourse. It can lead to bladder weakness and incontinence, and it can lead to a degree of prolapse. So, what the radiofrequency does is it allows those elastin fibers to come together so that the vagina becomes well supported, it tightens, and it really helps with sensation with women who are experiencing some incontinence because of a vaginal birth, and also prolapse of the womb because it's not supported as well by the vagina.
This really feels like we could be preventative about some of this because I'm thinking of conversations I've had with some of my elderly relatives, female relatives who, I hear them talking about this prolapse. Is this something that you see also in elderly women?
Oh, yes. So laxity and prolapse becomes worse with age, with menopause, with gravity, with loss of hormones. So this is again something that doesn't tend to improve with age. Um, Doing pelvic floor exercises obviously is very important to maintain the strength of the vaginal muscles
I'm squeezing mine right now.
and the pelvic floor. Um, but it doesn't tighten the vagina. It doesn't really improve the collagen or the elastin. So radiofrequency can be done 6 weeks after a vaginal birth. That's probably absolutely the best time to allow the vagina to heal, because that's when it's just healing and coming together from a vaginal birth.
Is that the ideal time, or can you still have it done 6 months, 3 years later?
You can have it years and years later. So studies are showing equivalent results if women are having it 6 weeks after a birth or at the time of the menopause and into their 50s and their 60s. It still has a really effective outcome. But if you're a young woman and you've just had a vaginal birth, it helps the vagina recover. When I was a very young doctor years ago, I had a 24-year-old lady come to see me in clinic, and she'd just had a vaginal birth. And she said, I think I've got a problem with the vagina. I'm leaking a little bit. So I examined her. I did the urodynamic studies that we normally do to investigate bladder function. I gave her the great news that it was all great. Everything's fine. Everything's normal. And she looked at me with a really puzzled expression and said, but I don't feel anything. And, I didn't realize it then, but she wasn't feeling anything because the vagina was lax and she had completely lost sensation. And, we're always talking about how important it is for men to have a great sex life. What about women? We should also be prioritizing our sex lives. There's nothing wrong with that. Young women and older women, we should also be prioritizing our pleasure during sex if that's what women want.
Absolutely,
There are
absolutely.
so many drugs out there for erectile dysfunction, yeah?
Yeah.
And it's all about the men. Well, we need to make it all about the women now.
Well, thank God for you, Dr. D, because, without you in this episode, now women are becoming more informed about it, and now we can do something about it. Can HRT help?
Not necessarily. I wouldn't give systemic HRT to a woman who has vaginal dryness and not particularly menopausal symptoms. I don't believe in high doses of HRT. And HRT is not all about estrogen, it's all about balance of estrogen, progesterone, and testosterone, because each of those hormones have equal important effects in the body in different ways. So I would never increase the dose of estrogen in the HRT to treat the vagina. I keep the levels low, and then I will, in addition, give some vaginal treatments, whether that's vaginal estrogen or whether it's vaginal DHEA or testosterone or the laser or radiofrequency. There's always a solution. But systemic HRT is not for the vagina. It's for hot flushes, it's for anxiety, it's for insomnia, it's for joint pain, it's for, heart health. The vagina, the HRT doesn't always reach the vagina.
So if you are on hormone replacement therapy, you may still need some additional support if you're experiencing vaginal dryness.
Absolutely.
I also read that regular sex or vaginal stimulation can help keep your vaginal tissues healthy after menopause.
So any kind of stimulation, touching skin and tissues, stimulates collagen. So absolutely regular sex.
With or without a partner, though, right?
Yeah, absolutely.
Yeah, you don't need a partner. My husband's going to love that one. Or some of you might go, oh my God, don't tell anybody that. Sexual activity with a partner or on your own, for pleasure. But now we know these added benefits, right? Like more blood flow, makes your vaginal tissues more elastic.
It raises your endorphins. It raises oxytocin. It makes you feel good about yourself. It increases happiness. What's not to love?
I love it. On that note, I think we're going to move on to our last question. Tania, I feel this episode is like the moon landing. Like everybody is glued to their screen. They've got their earbuds in. We do ask all of our guests one last question, and that is, knowing what we know now about vaginal dryness and the menopause, what would you tell our 35-year-old listener, our 45-year-old listener, and our 55-year-old listener?
So to the 35-year-old listener who may have just recently had a couple of vaginal births, I would be talking about optimizing vaginal health, maybe thinking about having a radiofrequency treatment, certainly focusing on pelvic floor health and doing pelvic floor exercises to keep those muscles strong, being proactive, and keeping the vagina really healthy. The 45-year-old, well, to be aware of vaginal dryness that may be starting at this age, even though she's having regular periods, it can start many years before, and to start addressing it as well, again with topical moisturizers or estrogen, but to start treating it because you really want to maintain vaginal health at that point. She may also be experiencing some perimenopausal symptoms as well. And then the 55-year-old, usually at this age, women are into their menopause, and things like dryness, bladder issues, sex, they can really be problems at this point. So really to be thinking about how to hydrate and treat dryness with the topical products or with a laser or radiofrequency or injectable hyaluronic acid.
Because you can get your life back.
And more. Sex can be even better in the menopause than it was before.
Woo! I love it.
Yeah.
I love it. We need more of you. Will you come back?
Absolutely. I'd love to.
I would love you to come back. Dr. Tania Adib, thank you for joining our menopausitive community.
Thank you so much for asking me to come today.
Now, everybody, wow, I don't know about you, but there was a lot I learned. It is so important we talk about this stuff. We can normalize it because chances are if you're experiencing it, some other woman, another friend is experiencing it. And even if they're not, be the friend that tells them about it so that we can all experience long, healthier, happier lives. A few big takeaways for me. You do not need to accept that this is the norm, right? Vaginal pain, discomfort, that does not need to be normal. In fact, it's not normal. There are so many options to ensure you can enjoy sex and intimacy well into later life. And if you don't use it, you lose it. So talk to your doctor or your GP, because the good news is that all of these things can be treated or reversed. And thank God for people like Dr. Tania Adib, because together, ladies, we're going to redefine menopause. See you next time. Oh my God, that was genius.
Was it okay?
It was brilliant. Now, as we have everybody around my virtual kitchen table, Tania, speaking of collagen, these are my famous almond butter dark chocolate collagen biscuits. Would you like to give one a go?
I would.
You can squeeze in if you want. Here you go. I should have
Thank
brought.
you.
Oh, I should have brought napkins. Here,
So what do I do? Do I
you can use.
slather it on my
This could be-
face?
take a piece of paper. This could be like a napkin. Do you slather it on your face? Wouldn't that be great? Anyway, they're
Oh
one
my
of
God,
my
it's got
favorites.
chocolate.
Oh, and by the way, I knew you were menopausitive when you downloaded this episode. Thank you so much for joining me today. I love bringing this information to you, and I love that you're taking control of your health. You can follow Menopausitive on Instagram, TikTok, and LinkedIn. If you haven't yet, please subscribe, rate, review, and share this podcast. Join me next week as we discover more ways to optimize our bodies. Because together, we're going to redefine menopause.
I got a good feeling.